Okay,
Great.
Nelly, please.
Thanks, Linda, for your introduction. And I'm really happy to present on behalf of my team that information on studying consensus methods in integrated knowledge translation to promote patient-oriented research. So the project leads include myself, plus Heather Gainforth from UBC Okanagan, Katrina Plamondon from Interior Health and UBC Okanagan, and Davina Banner from UNBC. We also have co-researchers or co-Is involved, Kate Sibley from Manitoba and Jennifer Bombush from UBC Vancouver. And research users, we are in the process of talking to patient partners as well as decision makers from the health authorities around our project. Next slide, Pat. So why study consensus methods? Well, there's very little information in the literature on priority setting and consensus methods, particularly in the use in the KT and IKT area. We also know that it's important to look at evidence-based solutions to address the priorities and needs of communities, and then also incorporating patient priorities. So different consensus methods could include such components as Delphi methodology, nominal group, and deliberative dialogue. And we're doing a literature, a systematic review, so we may indeed find others as well. So for example, deliberative dialogue has been used for practice and policy change for MP integration and family violence prevention. The MP integration study is a study that we did in the interior region about 4 years ago with a very fairly successful deliberative dialogue approach. Next slide. So the aim of the project is to better understand effective consensus methods for use in IKT and patient-oriented research. Specific objectives, we want to know how researchers and research users working in partnership are using consensus methods. So how can we actually partner together and use them together for an integrated knowledge translation approach. We will compare, contrast, and test different consensus methods, and we will develop guidance that supports IKT researchers and research users to use the methods in their work. Next slide. So this is a bit of a busy slide, and that's because we were limited to 3 slides. Yeah, that's okay, Allison, I get it. Anyways, we have 3 phases in our projects that are all being co-led by or led by one of the co-PIs. So we're doing a knowledge synthesis, which is being led by Heather Gainforth. She will be conducting with her trainees a scoping review of the IKT partnership literature, and then also conducting a systematic review of partnership review papers, so a review of reviews. And then we will actually have interviews with researchers and research users to talk about how they've used consensus methods and to guide their decision making. Phase 2 will be the bulk of our project and will occur in years 2 and 3. And this is where we have the little figure here to outline what we're going to do. So initially, we're going to have a virtual deliberative dialogue to gain consensus on a second method to test in phase 3. So we will test deliberative dialogue, but we would like to test another consensus method as well. And we will include knowledge users and other key stakeholders from across the province to help us make this decision. The second stage then will be conducting 2 deliberative dialogues, one in rural and one in an urban center, with patients and community members to determine how best we can include these individuals in consensus building methods. And then in stage 3, we will test 3 approaches of deliberative dialogue and additional consensus methods determined in stage 1. And we'll test 1 approach in each of the BC health authorities. And we're going to test looking at a face-to-face deliberative dialogue, at a virtual deliberative dialogue, and then a combination of face-to-face and virtual, where we will send facilitators out to an area. And then we'll also test the 3 scenarios with another consensus building method as well. Our focus of our study is going to be looking at care transitions in mental health from hospital to community. We need to have an issue that we can actually build consensus around, and so we're studying the method, but hoping also that our work will then be valuable in moving improvements in care transitions forward as well. Finally, in phase 3, led by Dr. Banner, we will engage knowledge users and partners and stakeholders to create and implement relevant and responsive end-of-grant KT activities. KT will be addressed throughout the project, but the actual development of resources, et cetera, will be done in phase 3. And so we're looking at things such as specific resources for decision makers, policy makers, patients, a toolkit, perhaps, and a casebook of narrative stories. Thank you. Unfortunately,